A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a heated Senate Finance Committee hearing on September 4, 2025, Health and Human Services Secretary Robert F. Kennedy Jr. found himself under intense scrutiny regarding his controversial stance on vaccines. The session, initially intended to discuss President Donald Trump's healthcare agenda, quickly transformed into a battleground where Kennedy faced criticism not only from Senate Democrats, but also from unexpected Republican allies. The backdrop of this confrontation was a week of turmoil at the Centers for Disease Control and Prevention, CDC, where Kennedy had recently fired former CDC Director Susan Minares, prompting several senior officials to resign. This upheaval raised eyebrows among lawmakers, who questioned the stability and reliability of the agency's leadership during an ongoing public health crisis. During the hearing, Kennedy attempted to defend his actions, asserting that he supports vaccines and aims to provide clear, evidence-based guidance to the public. However, his remarks were met with skepticism. Senator John Barrasso, a Republican and practicing physician from Wyoming, expressed deep concern over Kennedy's commitment to uphold vaccine standards, citing recent measles outbreaks and a lack of trust in the CDC's leadership. Americans don't know who to rely on, Barrasso stated, emphasizing the need for transparency in vaccine recommendations. Kennedy's response was met with further probing from other committee members. Senator Bill Cassidy, a Republican from Louisiana, highlighted a potential conflict of interest regarding Kennedy's appointments to the Advisory Committee on Immunization Practices. Cassidy pointed out that some nominees had served as expert witnesses in lawsuits against vaccine manufacturers, raising questions about their impartiality. If we put people who are paid witnesses for people suing vaccines, that seems like a conflict of interest, Cassidy argued. Kennedy, however, dismissed these concerns, maintaining that while the situation might appear biased, it did not constitute a conflict of interest. The tension escalated as Kennedy faced accusations of being anti-vaccine, a label he vehemently rejected. Saying I'm anti-vaccine is like saying I'm anti-medicine, he declared, asserting his commitment to medicine while acknowledging that some treatments, including vaccines, come with risks. Senator Roger Marshall, a fellow Republican and ally of Kennedy, supported this viewpoint, arguing that the focus should be on empowering parents to make informed decisions rather than imposing a one-size-fits-all approach. As the hearing continued, it became evident that Kennedy's leadership style and decisions regarding vaccine policy would be scrutinized closely. The fallout from the CDC's recent upheaval and Kennedy's controversial actions has created an environment of uncertainty surrounding public health guidance, leaving many lawmakers and citizens questioning the future of vaccine policy in the United States. Kennedy's promise of radical transparency in healthcare will be put to the test as he navigates the complexities of vaccine recommendations and public trust in the wake of the COVID-19 pandemic. With the political landscape shifting and public health at stake, the coming weeks will be critical in determining how Kennedy's policies will shape the future of healthcare in America. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.